Parents, caregivers, and all who care for our children, women, and mothers. Our twice-in-the-year intervention for our women who are pregnant, due for delivery, who want to plan their family and know their HIV status, as well as our children under 5 years to screen for malnutrition, get much-needed vitamin A, deworming, as well as routine immunization. We are here again from the 10th to the 17th of August 2022 in our health facilities and in our communities. Maternal, Newborn, and Child Health Week Round 1 2022 is here again.
Good day, viewers. Welcome to the River State Dialogue, the platform where we weekly sensitize and educate the populace on government policies, programs, and activities. And in doing that, we consciously get a feedback for government to properly fine-tune our policy to suit the people. Viewers, God Almighty, speaking in the Holy Book, in 3 John 2 said, I wish above all things that thou mayest prosper and be in health. Take note of that word. And be in health, even as your soul prospereth. Now, in the sustainable development goal, the goal 3 specifically said good health and well-being. So health, the importance of good health and well-being cannot be overemphasized, as everything about man revolves around it. Now, when your health is compromised, everything, business and everything you do comes to a standstill. At that point, everybody is running helter-skelter, thinking how to bring back your health to normality. Viewers, today we will be discussing the topic Maternal and Child Health Week, life-saving intervention. Joining me in the studio today for this conversation, I have a person who is not for the first time coming to the studio. She's been with us here, previously. She's no other person than Dr. BABBO Diana. She is the health educator, River State Primary Healthcare Management Board. Now you're welcome to NOA River State Dialogue once again.
Thank you very much. Good morning, viewers. It's a pleasure to be here again.
Yeah, and viewers, your comments are highly needed. Please keep the comment coming. We'll have a new platform for you, which is the phone line. It will be open in due time. Madam, I just want to start with this on this note. What is the Maternal and Child Health Week all about?
Thank you very much, sir. Well, Maternal, Newborn, and Child Health Week is a high impact at no cost to the receiver intervention that happens twice every year. It started happening in March 2010. It happens in May and it happens in November. And it aims to deliver interventions to our mothers and our children with the objective of reducing maternal mobility and mortality, as well as childhood mobility and mortality in children under 5 years old. So we deliver these interventions to this group of persons, and the aim is to reduce deaths and mobility in them. Yes.
Now, what are the objectives of the Maternal and Child Health Week, Newborn Health Week?
Okay. The main objective, like I said, is to reduce mortality, which is death, in women of childbearing age. They are pregnant, they are about to give birth, they are giving birth in the first 6 weeks. We do all that for them. It's also to reduce mortality in children 0 to 59 months, that is under 5 years old. Yes. Then specifically, we want to ensure that they utilize health facilities to generate a health-seeking behavior in our mothers and in the children as well. These children can come to the hospitals by themselves. So the mothers know that there's a health facility that is functioning. They can carry the children to this facility and utilize the facility over time. So we aim to, so to say, advertise the health facility in this period twice a year. with these intervention packages. That's what we do.
Now, we recall, this week has been on for some time now. Now, the last one took place in the first quarter.
Yeah.
In the first, quarter of 2022.
Yeah.
Well, now, why this, the renewed interest? Were there some specific challenges that were thrown up that this one is, to address?
Okay, thank you very much. Like I said, twice in a year,
okay,
we observe maternal, newborn, and child health week. That's every 6 months. That's because some of the interventions we give are a duration interval of 6 months. Like the vitamin A capsule we give to children is every 6 months.
okay.
The deworming we give to children is every 6 months. So there was no specific challenge. All over the nation, they celebrate maternal, newborn, and child health week every 6 months, twice in the year, May and November. Well, for us, we had our second round of maternal, newborn, and child health week in March. That was for 2021. So this one we are having now in August is our first round for 2022.
Now, are we expecting, something new in terms of targeted population, approach and strategy?
Our target population still remains our women and our children under 5 years old. In terms of strategy, because schools will be out of session this particular round, we intend to add going house to house, a house-to-house campaign with our vitamin A and with our dewormers. We also intend to do a house-to-house drive for people to come out of their houses and use the facilities around them for the other interventions like the injectables, because there will be immunizations for our children. There will also be COVID-19 vaccination for our men. So they need to come to the facility and access those ones. We can't take it door to door. But the ones we can take door to door are the dewormers and our vitamin A. Are going to do house-to-house strategy campaign this time around because schools are out of session. Otherwise, when schools were in session, we'll go to schools to deliver dewormers and then vitamin A supplementation to the children.
Meaning that this newborn health week and maternal and newborn child health week is not exclusively for women.
It's not.
Men are also.
Yes, our men are also very welcome.
No, I want you to re-emphasize on that part of men.
Okay.
Where are the men coming in?
Okay, during the week, a man can bring his wife to the health facility. Just accompany her. Supposed to be on holiday, so people will be at home. Maybe they are just having a leisure time. You can bring your wife to the health facility. While you are there, you are going to hear the health promotion topics that will be given. We give lectures on health education topics like hand washing, sanitation, breastfeeding, family planning. They are going to give a lot of health talks during that period. And a man hearing those things will benefit from that knowledge. That is one. Number two, the men are also going to have their health checks, their weight, their blood pressure, their height, their body mass index estimated for them, and they will be advised on the necessary things to do to keep healthy if they are not, or to continue in whatever path they are in if they are healthy as per this period. Then there's also the COVID-19 vaccination for the men as well at the facility. They can also access family planning methods like utilization of condoms. They can pick a condom or pick 2 condoms while they're in the facility with their wives, and utilize their services. They can also have their HIV test done in this week. So there's a package. That's why it is termed maternal, newborn, and child health week, which is our primary target. The men are also welcome, and when they come, we don't chase them away.
All these things for the men, it has at no cost.
Yes, it is at no cost to the user. Somebody has already paid for all these services. Okay. We have partners. We have the River State Primary Healthcare Management Board sponsoring this particular round of maternal and child health week. Before now, we used to have SOMIL, Saving 1 Million Lives, sponsor our maternal and child health week in River State. But this round, the River State Primary Healthcare Management Board is sponsoring it fully.
Now, health is said to be concerned to all. Now, who are the key stakeholders, in the forthcoming maternal, newborn child health week? Now, how would you rate their support? Are you getting, any cooperation from, the private sector, and to what extent?
Okay. Thank you very much. when you say stakeholders, I want to thank NOA for this platform. You are stakeholders even in driving this sensitization process for MSCHW. Yes, you are stakeholders. We also have the traditional leaders, we have our religious leaders, interfaith and group. We have different groups. Media, for example, is also supporting us. Some of them are private stations that are giving us their platforms free to sensitize concerning the week. So it may not be money per se, but in terms of the visibility, we are getting support to sensitize and create awareness for maternal and newborn child health week this round.
Okay. Yes. So which means that the stakeholders are complying as they ought to.
Yes.
What of the private sector?
I've mentioned that some media stations are owned privately.
Okay.
If not only Radio Rivers and RSPHCMB, they have their full support because they are governments, but there are other private stations that have, like Silverbird has given us some support.
Okay.
Yeah, so they are private stations that give us visibility to use their platforms to advertise for maternal, newborn, and child health week.
Now, I want you to throw more light on this. You know, there is this research has shown that when a woman dies, you know, via childbirth, now the kids, he or she, have just 19%, you know, chances of survival. You know, I want you to throw more light on this. You know, that is for the first month, the child has just 19%, you know, percentage of survival. Can you please throw more light on this? Why?
Okay, you know, not to overemphasize mothers, but mothers are really important. You know, a child can probably do without a father for a while, but the mother's role is so key. We don't only bring the children into the world, we nurture them. Imagine a child who lost his mother at birth. You know, that breast milk that you would have been the first form of immunization for that child is in need of that particular one. It's in need of that bonding, that nurturing, that care of your mother. You know, and it begins to tell on their psychological well-being as time goes on. Except maybe there's a caring auntie or a caring sister around. But you see that child withdrawn. A mother's support is very important in the home. Apart from that, who takes care of the child when it messes up? How many fathers will go and clean up and then make the child comfortable? But mothers are particular about that. Who does the cooking of the food to get a balanced diet for the child to have? How many fathers will go that extra mile? A woman will starve herself of food to make sure her child has the adequate nutrition the child is supposed to get. You know, so mothers are so important. And one woman who dies in pregnancy, during delivery, or in the first 42 days of delivery is a lot. And our statistics are so high of women dying in this period. But we're saying even that one woman is a lot. And we don't want that to happen. There are skilled birth attendants, there are trained nurses, community health workers at our health facilities that will give intelligent service to a woman that is pregnant. You know, if you go to the Mama Ejo, for example, the woman does not know where you are in danger. She doesn't check your blood pressure per se to know where you are in danger to refer you or to intervene. And they let you go and then you get into trouble. Or you come to a facility where there's a trained nurse, there's a trained doctor, or a trained community health worker that can look at your vitals, look at you and say, Madam, you are in trouble at this point. This is what we should do. Okay, now it is beyond us. This is where you should go. That's why we say it's a life-saving intervention for our mothers, even our children. You know, there are vaccine-preventable diseases around. Polio, tuberculosis, you know, hepatitis. If our children don't get these vaccines as at when they are supposed to have them, they will have these illnesses and they will die of preventable diseases, very preventable diseases. So we are encouraging them to come to the facilities and utilize these services. What are we going to give during the week? We'll give routine immunization to children. We'll give vitamin A supplementation to children. We'll give dewormer to our children. We'll check their nutritional status to know which ones are undernourished or overnourished, you know. We'll also, for our women, register them for free. Antenatal care is free during that week. So, you know, this period, I keep saying that our women, it was cold in June and July. So a lot of women are already pregnant. Utilize this period to register for free in the facility.
Okay, at this point, let us join our correspondent who's on standby from Eche local government area where Irene Haikelem is on standby. Please, Irene, take it up from there. We're listening.
Yes, and for having me with the show this morning. I'm at Model Primary Health Center in Eche local government area. Sitting with me here this morning is Mrs. Charity Mwankwan, the Social Mobilization Officer, SMO, in Eche local government area. Mrs. Mwakwala, you are welcome in the show.
Thank you very much.
Our topic this morning says maternal and child health week, life-saving intervention. In your own opinion, what is this life-saving intervention?
Thank you, madam. Life-saving intervention are those services we carry out in our facilities, communities, and outreaches that help to reduce deaths in our children and women of childbearing age, even the pregnant mothers. And what are these services? They are the immunization we give to the children, DT we give to the mothers, family planning, the MUAC tape we use in checking the children's status. Then, for the men, we check for their BP. And we do this in this MNCH week. And doing them, we must mobilize the community. We must get to the chiefs. Then we must get to the pastors that are important, because if they say no, the members will not. We get our youth, the women leaders, then we'll tell them what they will benefit, the importance of taking all these services. Then after this, the next thing we'll do is to return our account and answers and tell them the message they will give to the community. And before you know it, the program is on and we achieve the success we are looking for.
Thank you, Mrs. Mwakwala, for your contribution. Few people have heard what she said, that we cannot do it without reaching the stakeholders. Thank you, Mr. Blaise Senewo. This is our contribution from the Eche local government area.
Thank you very much, Irene, there, for your very well thought out report. Now, while she was talking, I take note of certain, we talked about stakeholders. We're talking about the private sector, but she said something there. She said something about the traditional rulers, the clergy, now. Let me go back. How well have we been able to, for this time, how well have we been able to, utilize that level of stakeholders? Talking about the clergy, talking about the traditional rulers, those gatekeepers, in the communities. How well have we been able to reach them?
Okay, thank you very much. Lucky enough for us, in the past month or two, we've had regular interface with our community, so to say. So we've had meetings with our traditional leaders, youth leaders, women groups, and the aim then was for COVID-19 vaccination. So we've been in regular interface with them, and we are still interfacing with them. So in this particular week, we are beginning to also speak up about MNCHW. This week, 1st to 7th, is breastfeeding week. We capitalized on that interface with them to tell them about our breastfeeding week campaign going on this week. And then we are also using that same platform to tell them about MNCHW coming up from the 10th to the 17th of August. So we are in touch with them at the grassroots. Like she said, if they don't accept it for their members, if they don't accept it for their community, then it's as good as we bring in services to the public, and we are going to be left with our services to ourselves. And we cannot take the vitamin A alone. We need them to also take it.
Okay, now, when interventions are delivered, during labor, and childbirth, and immediate, newborn care is provided, up to 51% of newborn deaths can be avoided. Is this true? Please enlighten. I want you to take your time and enlighten them, our viewers on this, because a lot of pregnant mothers and people seem not to take advantage of opportunities like this, and then we are still recording very high level in infant mortality. So I want you to take your time and sensitize them on this.
Okay. I had said earlier that we have opportunity for women to register for free at the facility. They are trained health workers, nurses, doctors, community health workers that will detect when something is going wrong in the course of the 9 months of your pregnancy, or when you are on the table giving birth. They know something is about to go wrong, and they know what to do at that point. A lot of women die from hemorrhage, bleeding, when they deliver at that table. As a nurse, as a doctor, a woman is hemorrhaging before you know something to do to buy you some time before you send her to the next level. The woman that is by Mama Ejo or Mama Iyabo Does she know what to do? We lose a lot of women that way. Peradventure, the woman is having BP in her pregnancy. We can detect it, we can begin to intervene and know when to refer such a person. Will Mama Ijo know the same thing? No. So we're saying that there are trained people in the facilities that will look after your pregnancy, look after you during labor and delivery, look after your child. A child is born, does not breathe in the first minute of life. We that are workers, that are trained health workers, we know what to do at that point. Does Mama Ijo know what to do?
Now, but let me ask this question. These CVAs, as we call them, traditional pet attendants, they've been satisfied and they work with people. Does it mean that people are not supposed to patronize them or to go to that place at all?
Because we know that
Let's clarify.
Yes, because we know that the public seems to have a lot of confidence in those women. Instead of embellishing that arm of work, we are saying, okay, TBAs, come, let us give you a little training. We tell you your limits. When you see this, that is where your work stops. Send that woman to the health facility. Let us continue that management. Don't manage her again. So we have that relationship with them. We don't call them TBAs. We call them community health reproductive influencers. We have funkirized their name.
Okay.
So to say. So to bring them close to us so that they can learn from us, know their limits, know when to refer or send we call it referrals. Send a woman from that your small shop to the health facility so that we can continue that management and that woman and her baby can be saved.
Now, it is health experts opine, that immunization, let's just talk about immunization now. Immunization yields up to 44, %fold return on investment, and our VAT, in low and middle income countries, and our VAT, an estimated 2.3 million child deaths, each year. If this is true, why is it that the rate of infant mortality is still very high?
Okay, thank you very much.
In Nigeria, particularly in Nigeria.
Yes, thank you very much. There's what we call zero-dose children. They have never had a single immunization since they were born. There are those that are missed opportunity children. During campaigns like this, we say, come to the facility, bring your card as a woman that has been vaccinating your child. And they don't come. That's a missed opportunity. So the fact that we keep saying that come and take your immunization, they are what we call vaccine preventable diseases. Take a vaccine, an immunization like BCG, OPV, DPT, give to your child, and your child will be free from that group of illnesses called vaccine preventable diseases. But how many people come and assess that vaccine? 2019, 2020 was our COVID year. So we had, because we were on lockdown, we were indoors and rest, we had a big gap in immunizing our children. So all the gains we've had over the years from immunization, we have lost something because of the COVID years. We need to start picking up and catching up on that as quickly as possible, because we are beginning to see those measles is coming back. Yellow fever we are beginning to see again. We are beginning to see some traces of polio, wild polio in some African countries. So we have lost those gains, and we need to consciously, as a people, as a public, begin to come back and do what we need to do to have ourselves protected from these viruses, from these bacteria, from these illnesses. Because the vaccines are available, they are potent, they are safe, they are free, they are effective. Once we can do that, we begin to catch up again.
Now, diarrhea, is said to be the leading killing disease when it comes to age, 0 to 5. Now, he said that the home treatment is relatively very, very cheap. Now, if that is true, why is this huge death recorded, via diarrhea? I want you to, let's get this thing clear. Because the home treatment is relatively very cheap at no cost.
Yes.
Yeah.
During our health education talks in our maternal and newborn childhood, we talk about diarrhea and how to use oral realization therapy. So if the mother or a woman or a man comes to the facility during that week, you have the knowledge. Why we are recording such deaths because people don't have the knowledge of what to do. Your child is stood in, the first thing you do, you go and give all those things that they give in the chemist. They make something for you and give to your child. Meanwhile, the life-saving drink, the oral rehydration salt that you just mix and give to the child, is something like you said, is very, very cheap. A sachet is about 100 naira, in some places 120 naira. And water is available everywhere for you to use and mix it. Why the children die from that diarrhea is from dehydration. So we don't need what will stop.
Sorry to cut you, said water is available everywhere. And you know that good water, getting clean good water in Nigeria is not as easy as you just said it.
Yes. Yes, good clean water. But it is not impossible to get clean water around you.
Yeah.
And even if you have water, you can boil the water, let it cool before you use it.
Okay.
Even if it's not as clean as you would have expected it to be. You can get it, boil it, cool it, and use it. So water is with us. It may not be as 100% as we want it to be, but there's water that we can utilize for what we want to use it for. So
I want you to sensitize, to enlighten and educate the viewers on the ratio on this sugar salt solution. What do you do in the event of that? You are at home, probably you have sugar, cubes of sugar, you also have salt, you have clean water. What do you do?
Okay, you have clean water in your house. It's 1 liter of water, 5 cubes of sugar, and then 1 level tablespoon of smothers. Because some people don't use sugar in the house. Always have that sachet of ORT just lying about on your dining table or in your bedroom drawer. Just always have it around you, because you never know who would need it. It may not just be your child. What if you are stealing or your husband is stealing? You can just easily mix it and then use it. Always have that sachet in your house, because some people in that panic will just pour everything in and then mix it and say they've mixed 5 cubes and then mix 2. You may just forget the measurement, but with that 1 sachet and your 1 liter of water, you can never go wrong.
Okay. Now let's settle down here a little bit. We probably will want to take some more time. What can be done to prevent or reduce maternal and infant mortality to the BIYE? Let's look at it holistically. What can be done?
Okay, thank you very much. One of the things that can be done is what I am here sensitizing about, which is our maternal, newborn, and child health week.
Yeah.
If we can utilize these services, if mothers can be aware and know that health facilities around them are functioning for them to use, the doctors are there. They will get paid even if you don't go to the facility. So why not go and utilize them? The nurses are also there. They will get paid even if you don't utilize them. So why not go and use them? They are getting paid for these services. So what can be done is, this week we are advertising our facilities are open. These interventions are there regularly. For this week it is free. Going forward, you may need to pay a little something for it. But the fact that it is there, it is available for you to use. Do you know? Come and know. That's what we are saying this week. We are having a drive to advertise our facilities. So the key thing that can be done to reduce maternal mortality, child mortality, is for people to be aware and have a health-seeking behavior. When you are aware that there are facilities functioning around you, and you are conscious of your health and your surrounding, you know when something is going wrong, and you know when to move. We should know when to move as people.
At this point, let us open the phone lines. Viewers, the phone lines are now open, and the phone lines they are right on your screen. But however, let me just read them out to you. It's +234 91 66 58 7355. I take that once again. +234 91 66 58 7355. Please, when you call, straight your name, first and foremost your name and the location where you're calling from. Then you can make your contribution. Please, let's keep it simple, because this conversation is for education, it's for enlightenment. So please, any controversial, we will not entertain controversial comments. Please, Please just keep it simple. Thank you. You see, I want to take you, this thing. So what can we do? One thing that is very imminent in our local areas, even in township here, is the attitude of patronizing this our chemists. They call them doctor. They go easily, mix this for me, mix that for me, mix that. Even while the health center, like you said, is available, if even you don't go, they will still pay the medical doctor.
It's quicker to get to the pharmacy around you, pick something, than to go and wait on a long queue in BMH, or wait on a long queue in one general hospital, or wait on a long queue in one health center, But if you do the wrong thing, you will eventually end up in that BMH and in that place you are waiting to go to. The attitude of people definitely needs to change towards our health facilities, primary health centers, and the rest of it. If they come to accept that and then begin to use them and see the benefits in it and begin to promote it, it will go a long way to help us in society. We are not trying to discredit the pharmacists. Some of them are actually qualified to sell what they are selling, but they should sell on the prescription of those coming from the hospitals.
That takes me to another thing. You see, most times these pharmacists, they are actually qualified, very good pharmacists, good environment and everything. But I noticed a situation where, tests are done in those pharmacies, prescriptions are done in decent pharmacies, treatment are done in those pharmacies. Everything is that pharmacy. You hardly can see any person coming with a doctor's prescription to the pharmacy. Everything starts and ends in that pharmacy. That is also a worrisome practice. I don't know what's your take on that.
I'm in the same boat as you. I worry as well as you do about the decadence in our health system. People don't know their line. They don't know their profession as they ought to. Outside in more senior climes, it's not done the way you are talking about it. You can't just walk to a pharmacy and get a prescription and then get a consultation or get a test done. No, it's not done like that in senior climes. So we haven't gotten things right down here. And I believe that with time, as we keep talking about it, as we keep sensitizing about it, as we keep hoping that attitudes change, that we'll actually get it right. Because the right thing to do is you go into a clinic, a walk-in clinic, or a private clinic, or a government-owned clinic, see a professional that attends to you, checks you, refers you to another professional that will take your sample, do tests. That one will now send your test back to him or her, and then he will write and say, this is what I think you should take. He sends it to a professional who is a pharmacist, a pharmacy technician, to give you what he has written. That is how things should be done. So we'll get there. I believe we'll get there.
Yeah, at this point, let us we'll come back to the government. Let's join our correspondent who is on standby from Okrika local government area where Bushi Okebono is on standby. Bushi, take it up. We're listening to you.
Thank you, Mr. IBIYE. Good morning, viewers. My name is Bushi Okebono with the National Orientation Agency, Okrika local government area. Poor maternal, newborn, and child health care remains a significant problem in low and middle income countries. Worldwide, 250,000 to 280,000 women die during pregnancy every year, and an estimated 6.5 million children die under the age of 5. The majority of maternal deaths occurs during or immediately after childbirth. With me here is Mrs. Aya Charity. She is the Reproductive Health Supervisor and Deputy Primary Health Care Coordinator. Madam, with these statistics that have been given, what preventive steps or what safety interventions have been put in place to reduce this problem?
All right, thank you, and good day, viewers. In order to prevent maternal and child death, we all know in our LGS we have health facilities, so it is for the mothers to access these health facilities and utilize them. Early registration is the key. Once they register early in the clinic, they will be given health information concerning immunization, family planning, nutrition, and infection prevention. All these are intervention strategies. And then early clinical diagnosis. let's say if a mother comes to register in the clinic early enough and her BP is high, or possibly she has diabetes, it will be detected early and a treatment will be instituted, and you see that whatever problem it would have caused in course of the pregnancy, it will be controlled. And also provision of skilled personnel. The health facilities are there, they have skilled personnel, improved coverage, and essential drugs. All this will help to curb maternal child deaths.
Thank you, madam, for your time. Over to you, Mr. B.
Yeah, Bushi Okebono, thank you for your report there. Now, before we go, we went to join our correspondents from Okrika local government. I was just thinking of something. Now, during the last, the first quarter maternal and child health week, while we are sensitizing, the concept of sensitization in agriculture, where I am domiciled, where I work, we met some persons, and there was this point that say that health center, no, I won't come there. I will never come. I said, why would you come to that health center? He said that health center where if you go, let me just use the broken now, where if you go, then they look face, they don't even attend to you. Some people will talk to you anyhow, just talk to you anyhow. They don't care for people, they don't care for people. And so while they were talking, it just came to me. I want you to use this medium to also please enlighten, the health personnel, the way they talk to people, the way they handle, people who come to the health facility, not just for programs like this, on a routine, normal basis. So I just want you to, please, you are the educator.
Yes, let me make a passionate appeal to all my colleagues that are health workers. I know the country is stressful. We are all stressed out in Nigeria, But the thing is, we are professionals and we are trained as so. It's not our job to carry whatever our issues are from our houses to our workplace and then do reverse psychology on our clients. So as much as possible, it's a passionate appeal to my colleagues. Let's be very warm and welcoming to our clients, people that we provide service to. They too have their own issues and they come to your table. They expect empathy, they expect some sympathy, they expect you to be compassionate. Some of us are have it already in us, some don't. We have to consciously be to show empathy. So let's do the best we can so that the people can come to us. We are looking for them to come to us, not to fall into the wrong hands. So if our own attitudes as colleagues are improved, they will have confidence in us and they will come to us and utilize our services, whatever it is we are bringing to them. So it's a passionate appeal from me as the health educator for the River State Primary Healthcare Management Board. Thank you.
As a maternal newborn child week commences next week Wednesday precisely. How can you assess the level of your preparedness in terms of the states? How can you assess the level of preparedness?
They're already here. We just want to dispatch them to the LGAs. We have a logistic chain that we follow when our commodities come. Drugs, mama pack for the mothers, vaccines are always regular with us in the States. So we all have a logistic chain on ground. We've begun to sensitize the public, which we are doing here and now. We are ready. The week is upon us already. We are already ready for service delivery to the public as regards maternal, newborn, and child health week. As a state, we are very ready.
Okay, thank you. At this point, let us just take some comments and contribution from our viewers. Are you Kelly, you're streaming live with us? Thank you. Charles Okara, you're streaming live with us. Ellison Realdapa is streaming live with us. Thank you, sir, very much. Doris Omako, thank you for streaming live with us. This one is from Nekimba Williams. Sensitization of the national child and breastfeeding exercise should be a continuous process to save the child and mothers. Thank you for your thought, Nekimba Williams. However, what we are discussing is the maternal and child health week. The breastfeeding week is still on course as we speak. It's still ongoing. But all the same thing, thank you for your viewers here. This one is from a very informal Ezimora. why are those vaccines like chickenpox and MMR that can reduce high mortality in children not provided? Rather, it's only with a polio and worm vaccine that are always provided. Madam, this question is directly to you. I just want you to make a quick response before we go.
Yes, in Nigeria currently we don't have measles, mumps, and rubella vaccine in our expanded program on immunization schedule. We also don't have chickenpox vaccine in our schedule. You know, there are countries that have them regularly in their schedule.
Why do we have?
As a country, we have not adopted that. For now, we are about to adopt rotavirus. Before now, we didn't have rotavirus, you know, in our schedule. But we are about to, in the north, we've already kicked off on rotavirus vaccine. As it's provided to us, you know, we see the risk of these things, and then it's provided to us from the international bodies. We begin to provide those services. Some people go to private facilities and obtain these particular vaccines because they want to travel.
Now, sorry, let me cut you at this point. Now, apart from the international donors and some countries that help, you mean Nigeria do not consciously procure these things on their own?
Largely, our vaccines are donor driven.
Okay.
Largely, yes.
Okay, now this one is from Bridget Edemio. The organizers should work with report received from the field to know the challenges and the level of success so far. Oh, thank you very much, Bridget, for your thought. There, about time you're streaming live with us. Chiwapara, it's good to know that you're streaming live with us. This one is from Peter Ekabie. It focuses on the reduction of maternal, parental, infant, and childhood mortality and morbidity, and the promotion of reproductive health, and the physical and psychosocial development psychosocial development of the child and the adolescents within the family. Please, this person probably is an health person. He has used some very some language that are not very clear. So please, can you? I don't know whether I will go to the message.
And I think he was trying to throw more light on the focus of maternal, newborn, and child health week.
Okay.
That is focuses on reduction of morbidity and mortality. That is death from or disability from these illnesses. I think that's what he means by that comment.
It's good to know that you're streaming live with us. Thank you very much for your contribution. Ian, thank you. This is from Y Kana Command. What are the objectives of maternal and child health? I think we have dealt on that. The objectives. Mark, can you once again just throw a little light on the objective?
The general objective is to reduce maternal morbidity. Morbidity meaning disability from these illnesses. And then childhood under 5 is to encourage utilization of services like routine immunization, vitamin A supplementation, deworming for the children, nutritional screening for the children. Then for women that are pregnant, antenatal registration, iron folic acid supplementation, TT vaccination for the women, HIV screening for them as well. For those that are positive, they are linked to HIV care. Then there are those that want to choose a family planning method while they are still pregnant. There are others that are not pregnant that come to the facility. They are called women of childbearing age. They also utilize their family planning methods, and services, and they benefit from our health education or health promotion sessions during the week. Then for the men, like we have said, they will be screened for their blood pressure. Some of them will have their weight and their height done, their BMI told to them. They will be determined whether they are overweight or underweight. They will be counseled and advised as necessary. So it's a full package. It's a full package for them.
This one is also from Berry Ifoma Ezemora. He said there are other vaccines apart from the regular campaign ones that can prevent mortality. Please, what can be done to improve the health campaign to save more lives in children and mothers? So there are other vaccines apart from the campaign ones.
Yes.
Yeah.
Yes. When we say other vaccines, we call them routine immunization vaccination. There's COVID vaccination as well. There's rotavirus that is upcoming. So all these ones are packaged. The ones we go house to house with are the ones we drop, like the OPV. We can go house to house with that because we can carry it. But we cannot carry the injectables like the measles, yellow fever, penta. We can't carry them around with us. So those ones you can access at the facility. That is why we say during this week, come out to the facility. Spend that 1 hour or 2 hours with us and utilize every service that is available there for your benefit and for that of your family.
Okay. Thank you. Bushi Okebino, it's good to know that you're streaming live with us. In KG Nigeria, you're also streaming live. Thank you very much. In Okorobia, this one is Mrs. Rosemary Abe, thank you for streaming live with us. Douglas Madisi, thank you. It's good to know that you're there. Now, this one is from Rosemary Abe. Please let your sensitization emphasize more on disabusing the mindset of some mothers that the vaccines are adulterated and also their children are given underdose, and that is why even after taking the vaccine, children still get these sicknesses and diseases. I'm sure you understand what you mean.
I understand her.
Yes.
Thank you for your feedback. Most of the times during campaigns and even during our routine vaccinations, we give good quality vaccines. There are no under quality or substandard or underdosing. What we find with the children coming down with measles, for example, that have taken the measles vaccine, you come down with measles illness. It's called a breakthrough infection.
Okay.
And it's not because the child was not immunized. It's just that if you know the trend and the chronology of measles disease, you know that vaccine helped your child.
Okay.
Because what would have happened to the child without the vaccine would have been far worse than what you are seeing happening to the child that took that vaccine. So it's important for the child to have his or her routine vaccination as at when due. If the measles comes up, good and fine. The child will not be brought down totally like a child that didn't have.
Yeah.
Same thing with some of these diarrheal illnesses. You take a child has rotavirus vaccine, for example, and then has diarrhea later on. What you will see with the child that didn't have that vaccine will not be the same thing you will see with the child that had the vaccine. There's a clear difference. So the vaccines actually help.
That's true, sir. That's true. This one is from Adus Glass. Women should take advantage, of the provisions of health intervention surrounding maternal, newborn, and child health care in their various healthcare centers. Thank you very much. This one is from Interior. I encourage our mothers, especially the very young mothers, to practice exclusive breastfeeding. Thank you very much for your thought. Also, something is good to know that you're there streaming live. Tamurubo, you're streaming live. This one is from Jude Ungba. The program is designed to help mothers avail themselves of the health benefits they stand to gain. It is also an avenue to educate mothers and caregivers on the need to actually breastfeed their babies exclusively for the first 6 months of delivery. Thank you very much, Judemba, for your thoughts there. Bang Enyang, my concern is about immunization for children. Most times you take a healthy child for immunization. After taking the vaccine, the child became sick with high fever. Please, is there nothing that can be done? I think that is the side effect of immunization.
Yes, we call them adverse events following immunization. Yes.
Okay.
Yes.
I think this is the much. Okay, I will still have some time. We can still take some more comments. Faith, thank God. Thank you for streaming live with us. So, Tony Banigo, it's good to know that you're there. You're there. Okay, I think that's the much we can take. As the maternal and child health week commences next week. We have talked about this. Now, what is the message, to pregnant women, nursing mothers and caregivers? I want you to give them some very specific message, for them. Pregnant women, nursing mothers, and then caregivers. as we are rounding up.
Okay. Thank you very much again. For the pregnant women, this week your registration is free of charge. I know some of you know how much you pay when you come and register that pregnancy before the week, but this week it is free of charge. And then if you attend your antenatal for up to 4 times, you are entitled to deliver for free at the facilities, all our facilities.
Viewers, are you hearing this? Please take note of this.
Yes.
Say it again.
Yes.
I just want you to say it
Yes.
once again.
You register for free this week, and then you attend antenatal for up to 4 times. Your delivery is free of charge at our facilities. So that's a huge benefit to you. That's not counting the interventions you receive, like the drugs, the tetanus vaccine, and then the malaria prevention treatment. For our women of childbearing age, like I said, family planning is available for you. You can screen, you can have good quality information from our health education talks. For our caregivers, those that have children, bring our children to the facility for us. We will check to see if there are any vaccines they have missed. If there's any, we will give them. Those that have not had their birth registration done is going to be done for free this week at the facility. We'll screen them for malnutrition. It will surprise you to know that in our last round, over 1,000 children were found to be malnourished in River State.
Wow.
Yes. So bring the children for us to screen them for malnutrition. Then we will tell you what measures to take to build up that child. Because stunting is not a good thing. Malnutrition is not a good thing. It affects the development of that child. You will not see what is happening, but it is happening internally, and you will see the effect much later in the years. So we are saying caregivers, bring the children to us. We will check them, we will vaccinate them. Are there those that are malnourished? We will look out for them, link them to care, and we are looking for a healthy River State going forward after the week. Outside this week, we want you to have good quality care-seeking behavior. Knowing that these facilities you went to exist, knowing that services are provided there, keep using them. That's my message to our public today.
Yeah, I want you to, give a striking parting word, to our viewers as we round up.
Right. Life-saving intervention. That's what our topic is all about. And he that loves life will eat a lot of it. He that loves life will eat a lot of it. So I employ us. I want to beg and appeal. It's a passionate appeal. I'm doing my part. I cannot live your own life for you. Take responsibility for your health and that of your child. Mothers, take responsibility for that pregnancy and get the best out of that 9 months, the delivery going forward, and the best for your child. Maternal, newborn, and child health week is here to stay. It is for your benefit. Seize the opportunity, use it, promote it, and we'll have a healthy community going forward after the week. Thank you very much.
Viewers, this is where we'll wrap it up for today's NOA River State dialogue. I want to, on behalf of the agency, appreciate everybody that participated, that made it, a success today. I want to, on behalf of the agency, thank and appreciate Dr. BABBO Diana for our time, for our incisive, for our encouragement and everything. Man, thank you very much.
Thank you, sir.
We know that whenever we call you, next time you will always oblige us.
Definitely.
You will always be around.
Definitely.
So we thank you. Now, viewers, we thank you so much for your comments, for your contribution, for the questions you asked that made this conversation a very robust one. Thank you very much. For those, if there are any comments that we did not take, please, it's not because you're less important, it's because of for want of time. You can see that this program is time bound. It's just 1 hour. So please forgive us. Next time we will take your comment. I also want to use this time to appreciate the person that has given us this platform to air this River State dialogue. It's no other person that our DG is in person of Dr. Gaba Abari, is the executive producer of this program you're watching live. And I also want to thank our state director, Barrister Young Ayotamno, who is the producer of NOA River State Dialogue. My thank you can never be complete if I don't thank the man behind the camera. He is the HOD ICT. He is popularly called the Master Programmer. He is the studio director of NOA River State Dialogue. Viewers, is no other person than Arole Tenbricks. We thank you very much for being there for us, for your consistency. We say thank you. We also want to thank, the able hand, beside him, assisting him. She's a loyal person. Viewers, I can assure you, she's no other person than Ifoma Ilodigwe. Thank you very much for your assistance. Thank you very much for being loyal. Viewers, it is on this note that we'll wrap it up. Join us next week, same time, until we come your way again. Please, health is wealth. Take your health very seriously. The moment you have an health issue, everything becomes stand still. Bye. God bless you.